Hi, I'm Dr. Pamela Langendorfer with Lakeside Holistic Health. In this video, we're going to talk about the different labs that we offer here and have a little review of which ones and why we might run them. As are covered in some of the previous slides, what we're trying to do here is get you to a state of optimal wellness, and using these different labs are tools for us to identify where you might have some areas of imbalance, especially before they even happen. So part of our triad here as we're trying to build a good foundation for you, we're going to review your history and see if we can figure out where some of your triggers are. We're going to recommend some of the different labs to run. We're going to develop a life plan for you, and then we're going to use some of our tools such as diet, acupuncture, chiropractic, supplements, and exercise. So the standard labs that are typically ran are things like CBC, chemscreen, vitamin D, thyroid, lipids. Those are things that are traditionally just done at your regular lab. We will run those on occasion. Anything that we're recommending to you is really going to be based off of what we see in your history, and then we develop a partnership with you to decide which ones are priority and which ones we want to do first. So when I run a thyroid lab, I usually do a pretty thorough screen of your thyroid, and I check 6 different things. So I'm checking to see if you have any antibodies, if you've developed any autoimmune issues with your thyroid. I'm trying to see if you're converting enough of it into the active form, or if maybe you're converting it to a different pathway, which would be more of an inactive form that is sometimes due to high levels of stress. We also do stool analysis, which can help us to identify if you have any parasites or chronic infections going on. A lot of times this is actually a trigger for a lot of different autoimmune diseases. We do food sensitivity testing to see if you're eating things on a daily basis that might be contributing to some of the chronic health conditions that you have. We also run something called an organic acid test. And this test is probably one of my favorite tests because it gives me a snapshot of your chemistry. And so I can see things like, do you have issues with detoxification? Do you have an imbalance in your gut flora? Do you maybe need things like B vitamins? And oftentimes people are taking supplements that they quite honestly might not even really need. And we also do hormone testing. Our preferred method for this is urine testing because this gives us a pretty thorough picture of where your estrogen and progesterone levels are at, but also how you're metabolizing your estrogen. And this is really important, especially if women are going to be on bioidentical hormones. We want to see what you're doing with it and making sure the estrogen is being metabolized down a healthy pathway. We also do genetic testing, and a lot of the information coming out regarding genetics and the way that it impacts your health has a huge impact in terms of chronic disease and why some people might need certain supplements and some don't. So for example, if you genetically don't detox very well, that might be the reason why you have a lot of hormone problems. And you need to have a little extra support for your liver because your body just isn't able to deal with a lot of the environmental toxins that it comes into contact with. So that just gives you a variety of some of the different things we offer here. And please follow us on Facebook and like our page. You'll see updates on what's happening there. We also send out a monthly newsletter, and we try to keep people up to date on some of the other things that are happening at our clinic. Thank you.